Hi everyone, hope you're doing well. Just wanted to share some info from last week and the quiz from last week as well, and then talk a little bit about this week. So, last week we talked about a few different things, how health policy issues become defined as problems that we need to deal with via rulemaking and various policy actions, and then how different stakeholder groups at different levels are involved in developing policy, that whole legislative process, all of those kinds of things. And we also talked about some of the top issues being faced this year in health policy, and what we can do in those cases. So we had discussion, obviously, about COVID and whatnot. We had a written assignment, and our quiz and our ed puzzle. With the written assignment, I actually had several students that didn't complete it. So make sure that you're completing those on time. The other thing I will say is when you see this mark here, that means that it's a linked, or not a LinkedIn, jeepers, a Turnitin assignment, which means that you need to submit it at the first level, and then it'll process for a second, and then it'll ask you to confirm your submission. You have to confirm it. So it's two pieces to the submission. If you don't confirm it, it won't go through. So make sure that you're doing that. I know we had one of those last week, so just be aware of that. Actually, first, let's talk about this week to come. So in week 3, this current week that we're in, obviously, we're going to talk about diverse populations and the relation of health policy. So oftentimes, folks in maybe a decreased socioeconomic status situation, or folks that live in very rural areas, they can really be impacted by health policy, because sometimes directive health policy can help to provide more services to folks that otherwise wouldn't have access. So we'll talk about different health policy regulatory processes, and then some barriers to various groups, and how we can do a better job at providing services to them. There's a short film, well, it's not a short film, it's kind of a short film, but really interesting film called The Waiting Room. You can catch it on YouTube, which is the link here, or if you can access Pluto TV, you might be able to access, I know we have a Roku TV, and I can get to Pluto TV there. Really interesting about how oftentimes in a Medicaid-heavy environment, a lot of patients, they're not even in that, in a Medicaid-heavy slash uninsured heavy environment, a lot of folks use the emergency room as a primary care site. So really interesting film to watch, and some discussion there. You do have a case study assignment for for this week. You have the case study, which you can take a look at. Then we want each of the groups to kind of dig into chronic illness and mechanisms needed to receive care, and think about people living with chronic illnesses and access to care. If you have great insurance and live in a metropolitan area and have access to transportation, none of those things are problematic. But think about people that don't fit those criteria. Maybe you don't have insurance coverage. Maybe you do, but you don't have transportation, or you don't have you don't have a way, there aren't specialists in your area that cover those areas. So just think about those things, and then what I want you to do, going to create a PowerPoint. I want you to answer these questions down here with your thoughts on this research on chronic illness, the info you've read in the case study, and moving forward, I want you to do a PowerPoint document. Your groups are here as detailed in the classroom, but I also want everyone on their own. So the group only have to submit one project, but I want everyone on their own to do the self-and-peer assessment. Most of you have been in my class before, you know that I do those for any group project. Complete it on your own, upload it, and it can impact your grading. So if number one, if I don't get them, I can't grade your group's project, so everyone needs to submit. And if the overwhelming response is that a student was not involved in the project, then you will see anything from a decrease in your grade to a 0 for that project. So just be aware, these aren't the type of group projects where one person can do it all and everyone else coasts. We do require that all students be involved. And then obviously our ed puzzle down there. So let's talk a little bit about the quiz. I would encourage, that's week 2, sorry, not week 1. I would encourage folks to make sure you're reading the textbook carefully, and know that many of the questions that we will talk about or that we will have in the quiz are not necessarily lifted right from the textbook. Perhaps some of your previous coursework, you may have seen more of that. I'm looking for you to more to read what's there, but analyze it a little bit in question answering. So don't think that you're just going to be able to search the textbook or look in the index and find the answers. You're really going to have to take the time to read, perhaps take notes, highlight. I always encourage students to take notes by hand and not on a computer. But if you handwrite notes, it's proven via studies to increase retention. So just be aware of that. So the first question, I can blow these up so they'll take up the whole screen. The first question, true or false, a principle of social policy in the U.S. centers around the uniform standard of care and how quality of care does not vary based on ability to pay. And that is not true. Actually, from the textbook below are the principles of social policy here in the U.S. And generally, it's about the fact that healthcare is a commodity and distributed based on ability to pay. And there is no uniform standard of care. So quality of care varies based on the ability to pay. So that answer there is false. Next question. Health reform was once feared by politicians and American citizens due to it being considered, and that's socialized medicine. So when we look at health reform and transitioning over to something that would allow more people to be covered in the U.S. without extensive costs to the people, you're looking at a situation of socialized medicine. And this is discussed in the text, but when originally Medicare was feared, like people had proposed it, the Medicare system, something like that, a system of healthcare that would be reasonable in price to help those in the country that are elderly. And people that was at a time when, we were battling communism and the Soviet Union, and there was a lot of fear about those types of government-funded, government-run programs because communist countries had a lot of those kinds of things. So we had that kind of irrational fear. As we know now, many countries, like Canada has socialized medicine, Sweden has socialized medicine, the UK has socialized medicine. So many countries have socialized medicine, and it doesn't mean that it's a negative or problematic. Sometimes socialized medicine can provide a lower level quality of care, not because they're providing poor care, but because it's hard to access at times due to waits and whatnot. But generally, there was a great fear here in the U.S. Finally, they overcame it and were able to pass Medicare in the 60s. But there still continues to be some fear of the notion of government-run healthcare and the applicability of that here in the U.S. Two specific concepts in the development of the American healthcare system had major impacts on the system and have contributed to the problems seen today. Two of these concepts are, and it obviously says select all that apply, so we're looking for two answers here. The correct answers were seeing medical care as a commodity, and we saw that in the first question that we looked at. Medical care is seen as a commodity here. It's a business. This is capitalism. People make money off of it. The other question is granting a level of sovereignty to the healthcare industry itself over the organization and financing of healthcare services. So this is, another level in that the healthcare industry is who has developed the mechanism for financing here, private insurance companies, etc., as opposed to something that's managed at the government level. So those two concepts had major impacts on the system overall and contributing to the problems that we see. True or false, in the U.S. we value technology so highly that we often use more expensive high-tech treatments even though the benefit is quite small as compared to the increased cost. And that is true. Oftentimes we'll see the more expensive something is, the better it is. The higher technology it is, the better it is. But sometimes that cost-benefit ratio is not very well balanced, and we find that the benefit of using the high technology item over the lower technology item is small, and the cost is exponentially higher. So we really need to do a better job as an industry to make sure we're using the most cost-effective and clinically effective treatments and not just the most high-tech treatments, etc. So that answer was true. And I think that's it. Yep, that's it of those slides. So let's hop back to the classroom. Like I said, we have all those assignments coming up this week. If you have any questions, please reach out and let me know. But otherwise, I will see everyone in the classroom. Thanks so much.